All right, so thank you for those global tallies. Now we take a closer look at the domestic COVID-19 situation, and for that, our Choi Min-jung is here in the studio. Min-jung, it's great to see you again.
Thank you for having me, Sunny.
Right, then let's begin with the inclusion of medical clinics in treating COVID-19 patients.
Sure. Starting today, people will be able to get diagnosed and treated for COVID-19 at hospitals and clinics in their local communities. Around 700 clinics and local hospitals will be providing these services. They will provide one-stop services, basically meaning that those with symptoms can visit a nearby clinic and get tested for COVID-19. And if they test positive, that clinic will be in charge of prescribing medication and managing their recovery at home. If a person is experiencing a fever or respiratory problems, they can go to a designated local clinic and get tested for COVID-19 using a rapid antigen test. If the person tests positive, they would then have to take a PCR test. And once the person is confirmed with COVID-19, they will receive a prescription and medication and will be monitored by the clinic as they recover at home. It should also be noted that PCR tests will only be carried out for those at high risk, like people aged 60 and over, as well as those who came in close contact with a carrier. Once they test positive and are assigned to be treated at home, they will be monitored by hospitals 24/7. Medical staff will call in to check their conditions twice a day. But on the other hand, those who are at lower risk can get rapid antigen tests as well as PCR tests if needed at local clinics. Their monitoring will be less intense with once-a-day health inspections.
Right. Min-jung, I hear there have also been some discrepancies with regard to test results. Tell us a bit more about that.
Recent data from testing centers showed that not everyone who tested positive for antigen tests gets positive results for PCR tests. Data from 4 regions which carried out the new testing system earlier than the rest of the country showed that only 76% of those with positive results from rapid antigen tests were confirmed with COVID-19 after taking the PCR test. This means nearly 1 in 4 people tested positive for the antigen test but negative for PCR. This is mainly because antigen tests are much speedier but less accurate than PCR tests.
Right, and now despite the added capacity for testing, I understand concerns remain with regard to effective monitoring and treatment of COVID-19 patients.
Right, Sunny, the country has been reporting over 20,000 daily cases for 2 days in a row now, and officials are expecting the daily tally to hit the 100,000 mark in the coming days. And what's worrying is the available capacity for home treatment patients. As of Thursday, 97,000 COVID-19 patients are recovering at home. This is an increase of more than 7,700 from the day before. The government says that the maximum capacity for at-home treatment is currently at 109,000 and nearly 90% is currently in use. By next week, authorities are expecting the number to hit 110,000. And to keep up, officials are looking for ways to expand the number of hospitals that manage home treatment and use patient monitoring resources more efficiently.
Right, I see. Now, with regard to prevention efforts, Min-jung, our current guidelines are scheduled to end this coming Sunday, right?
Right, and authorities will be announcing new social distancing measures this Friday. This comes as the current measures, which include limiting social gatherings to 6 people and business hours to 9 p.m., are due to end this Sunday. The next measures will have to consider the current virus situation now that the Omicron variant has become the most dominant strain and daily cases are spiking because of it. But health authorities have said that it is best to tackle the spread of Omicron without imposing new restrictions. This comes as authorities are bracing for a potential 5th wave, with the number of infections expected to surge coming off the long weekend.
Right, and before you go, Min-jung, do tell us a bit about the new COVID-19 regulations at cram schools and shopping malls, which are slated to begin next week, I hear.
Right. Starting Monday, new rules are set to be put in place for these venues to minimize the spread of the virus. At places of learning such as cram schools and study cafes, students must sit 1 seat apart from one another. Previously, the limit was set to 1 person per 4 square meters, but it has now been revised to 1 person per 2 square meters. On top of that, authorities have banned promotional events, small concerts, and eating in stores at large shopping malls and supermarkets. Officials have advised movie theaters, concert halls, museums, and art galleries to strengthen antivirus measures as well. The stricter rules come as vaccine pass mandates were lifted at these venues last month.
Right, Min-jung, as always, and thank you for that report, and see you on Friday.
Thank you.